Good morning, RenoVo friends. This is Kelly, and today I'm here with Michelle Staggs. Michelle, thank you so much for being with us.
Thank you.
Yeah, so we're excited to talk to you. I know you have a very extensive science background. Can you tell us a little bit about that?
Sure. I actually have an undergraduate degree in biology from Hendrix College in Conway, Arkansas. And then I have a BSN in nursing. And then I have a master's degree in nursing and am an acute care nurse practitioner.
Wow. Well, thank you for all of the background that you have and the service that you provide. So needed. And at RenoVo, we love when people have a science background. I also have a biology and physiology degree, and we get excited because you really understand what this is about. So tell us a little bit about your equestrian background.
So, I grew up riding horses and then was out of it for well over 20 years. And so I got back into it just by trail riding and then really rediscovered the sport of barrel racing. And that's kind of, I guess I've not looked back from the equestrian side since then. I had the privilege of meeting Ray and Ginger Johnson when I met them through their daughters, especially Allie, who initially was the original barrel racer, I think, in the family for them. And so I've had the great opportunity to call them friends and been around them actually since I guess, the very beginning of the RenoVo project development that they went through. So I've really seen it evolve from really the infancy stages to where it is today as being one of the more innovative treatments for injuries in horses. So
Well, they love the friendship they have with you and getting to know you and be in the trenches with you of barrel racing. That was a lot of fun for them. So what were you using prior to discovering RenoVo?
my I have a horse. His name is Goose. Actually, have three horses, but the original diva, I should say that I have. His name is Goose. He will be 22 in the upcoming year, and probably when he was probably around 14 or so, he had some issues with arthritis in his hocks. He's been a team roping heel horse and was a failed cutting horse in his original career. So he's had a lot of wear and tear on the hocks. And so what was available really at the time and kind of what the standard was, other than just, oral anti-inflammatory type treatments, was to do a maintenance program with steroids and hyaluronic acid and some version or combination of those, depending on what veterinarian decided to use, whatever they felt was appropriate. So that was kind of when Goose got to the point where I could tell, and you can kind of tell a lot of times when a horse is just kind of off, not necessarily a true lameness when you're riding them, but just that they're off. That's when you start to really investigate what's going on. And so that's what I did with Goose. Dr. Greg Ford is the vet that I used for those performance issues. And so we started Goose on a regular program. Usually he was able to go twice a year with injections and things were great. His other joints were great. He's not had any issues anywhere else. It's really just been, the full hot joint that was obvious that it had arthritic changes. So we did that. And then I guess probably about 3 years ago now, one of my other horses needed to progress, I guess I should say, in a maintenance program. I had done injections a couple of times on him with steroids as well. And so when Dr. Ford looked at both of these two horses at the time, the other horse really, it was, his coffins that he really needed the RenoVo in. And so we had already decided to do that. And then when we talked about Goose, one of the things that the Dr. Ford said is, well, there may not be as much information about the success or the outcomes of using RenoVo in the bigger joints like the hocks. But, he said, I think that Goose would certainly benefit. He said that, he recommended to at least give that a try. And so that, like I said, was about 3 years ago. And Goose went from needing every 6 months, pretty much on the nose, injections in his hocks with steroids. We went to, he had RenoVo in each of his hock joints, and he has not required anything since then. The first year after that, I ran him just as often as I did before. I still run him and compete on him some now, not as heavily, but he still gets ridden regularly. And I have Dr. Ford check him. I have had him check him at least once a year because I haven't noticed any changes that would suggest to me that he needs any additional maintenance. And certainly with the lameness exams that Dr. Ford's done, the last one was probably about 5 months ago. Goose checks out with flying colors. So it's been a game changer for Goose, I would say, because of his age and because of the history of the previous steroid injections. I always worried about, as most folks do that have some form of a maintenance program for joints, that the breakdown of the joint and some of the other side effects just from the steroids themselves. With every pharmaceutical agent, there is a desired response that you want, but there's also undesirable responses. And that was always a concern I had with steroids. But I would say that for Goose, it's been a game changer for him. Even when I went out to feed this morning, he'll go running out of his stall and buck and play sometimes, which is, if you knew Goose, you would know that's a lot of expensive energy for him because he's not usually like that. But sometimes he just feels good, and you can tell when he goes out there and runs around that he just feels great.
Wow. Well, so many great points there. Thank you for sharing. And also thank you for being one of the pioneers. Here we are almost 13,000 cases later and so many success stories. So we love and want to congratulate the brave ones who did say yes when we were first just launching about 4 years ago. So what was it about RenoVo, having your science background, that really gave you the confidence to choose it?
So it works different. I'm really familiar with the PRP treatments, the platelet-rich plasma. We've done some things with that in the human environment as well. And one of the problems with those is it activates the inflammatory response in the body. And there's a lot of negatives that come along with that in the healing process. And part of what it promotes is the scarring. And part of the scarring process is, for example, wherever you have a ligament tear, there's a scarring that happens on either side of that. And the scarring actually produces a weakness in those areas. And so with RenoVo, it does not promote that inflammatory response, really. In fact, you have to let it work in the different way in that healing process, which involves part of that same cascade, but not all of it. And so with RenoVo, it actually promotes the healing so that it doesn't have the scarring and you don't have the weakness. One of the things that I know I've seen and read stories too of people who are certainly in the professional world of equine sports that, it's always been fairly common that if a horse has some form of a ligament injury or tendon or some other soft tissue type injury, that the risk of re-injury is very great. And part of the reason that it is so much riskier after an initial injury has always been because of that lack of natural flexibility and adaptability of those tissues. And with RenoVo, since it doesn't promote the scarring process, it actually promotes the healing process. The risk of re-injury to those areas is much less. And so I think that that's probably one of the greatest things that I see. I've had a couple of friends here over the last year that have had horses that had an initial injury. And one of the things that I asked them is, it's like, well, have you thought about RenoVo? Because what you're describing is something, these are these are horses that are in their prime. And, you know, 5 years ago, we had very limited options. Now we have the option of RenoVo and helping with that full and complete healing process. And so I've seen that be successful. So the world of the platelet rich plasmas and some of those other, and I'm not knocking those at all. Hear me say that. They certainly have their place, but that was the only option. And now we have the option of RenoVo, which leads us down a completely different path. And so I think that that's what I've seen, and what my, just from the science background and understanding the pathophysiology and the drug action, makes it a very, not just a viable option, but a potentially really successful option for those types of injuries.
That is so well said. Thank you so much. And obviously the risk is low for people to try RenoVo compared to so
Yeah.
many other things.
Yes.
Is there anything you'd like to add to that about being low risk?
Um, you know, like I said, I have two horses. Goose is the one that's only had it done just on his hocks the one time. Um, I have another horse whose name is Doc, who has had it. We've done it twice, not because of failure of the drug, but just because he needed it in a different place. Um, and so I would say that, you know, I know people sometimes look at, well, you know, what's the cost, or, you know, is the risk worth paying the additional? And I think if you weigh things out over time, um, the medication will pay for itself. So it, I wouldn't consider it cost prohibitive, even at face value. And so the risk, I think, is low. And what we all want is, we want our horses to be comfortable. We want them to perform at the top of their game. And we want to have the confidence that whatever we're doing, at the recommendations of our veterinarians, or, you know, we have the internet that certainly provides us an opportunity to be informed as well. And I think that when you look at the risk benefit, and when you research, and when you look at how does this treatment work, I think that there's really, like you said earlier, a pretty low risk factor in the overall scheme of things. And so I just, to me, risk benefit, when you weigh it out, it's, you know, it's a no-brainer in my mind.
Right. Yes. And I just want to be clear that RenoVo actually is not classified as a drug. It is a treatment.
Yeah,
So just wanted to make sure that
yeah,
there's,
and yeah, in my world, even oxygen is considered a drug in the so when I think of those agents, that's kind of what I'm thinking of. So yeah, no, yeah, RenoVo is a treatment that replaces those pharmaceutical agents.
Yes. So Michelle, for those who have not yet heard of or tried, or maybe they've considered RenoVo, what would you say to them?
I'd say if you have a horse that you've had evaluated by your veterinarian, um, that you should consider that. You should discuss that with your veterinarian. You know, RenoVo is not for every injury. It's not for every situation. You know, you hear stories about horses that have, you know, bone chips, avulsion injuries, those sorts of things, with ligaments off of bone. Those may not be the the condition that RenoVo will be the best option. So it's not necessarily an end all, but if you have a horse that you are trying to get on some form, or you're on some form of a maintenance program, and you're trying to figure out what the plan would be over time to keep your horse, you know, pain free, comfortable, competing at its highest level, and that you can have a bit of a peace of mind knowing that you're doing the best thing that you can, that you've talked to your vet with, and you make that decision, that that's what you should do. You know, and people talk about, well, this vet or that vet, you know, talk to your vet. You know, I have two different vets, because, you know, Dr. Ford who I mentioned earlier, does the performance side and takes care of that for my horses. But I have a local veterinarian here as well, Dr. Peck, who takes care of everything else. And the good part is, you know, he takes care of this part and Dr. Ford takes care of this part. But both of the vets actually are proponents for treatments. So, you know, it's just like in healthcare. So I'm going to frame it back into where my world is as a professional. We should always have an open mind about when a patient comes to us and says, hey, this is a new treatment, or a family member comes and says, hey, this is a new treatment. This is an option. Are you aware of it? Do you know about it? You know, as a healthcare provider, we have the obligation, I think, and the responsibility to research that question, to look at what does the science look like? What does the evidence support? What does the research support? Has it been published? Is it in peer-reviewed literature that these have been evaluated in a much more controlled type setting where there's the rigors of science are applied to it? And I think the same thing, that you know your horse care provider should be willing to do the same thing. And you know, like I said, I'm blessed that I have that, and I think a lot of us have that, so we shouldn't be threatened by that. And what I think I find is that most veterinarians, when their clients and their patients come to them, are certainly open to looking at that. I know the ones here in the Arkansas area are. There's several vets here in Arkansas that I know are proponents for both the RenoVo as well as the canine version of the treatment. So
Yes. Well, Michelle, so much wisdom there. We really appreciate your time and your expertise and your personal experience. We're wishing you the best as you continue on barrel racing, and may your horses be healthy. And we're looking forward to catching up with you again.
thank you. You guys have a happy new year in 23.
Thank you. You too.